This conference will now be recorded.
Good morning, everyone. My name is Emily Roman, and I am the Transition Support Team Manager at the Alamo Area Council of Governments in San Antonio. Anna Glaser is here with me, and she's a behavioral specialist on our transition support team. She has over 16 years of experience working with people with intellectual and developmental disabilities. And we're following up on a second part of our video in providing person-centered care for people with autism. In this video, Anna is going to talk to us about transition planning. And so without further ado, Anna, I'll turn the mic over to you.
Thanks, Emily. So we're going to start off with transition planning. I put some general guidelines that are really important to consider in transition planning. I think one thing that whenever you are helping somebody transition into adulthood should consider is, what are the outcomes that you are expecting? And I generally start helping my clients with transition planning when they enter high school. So, I think that's about 14, 15 years old. I feel like this is kind of when the clock starts ticking, because generally, people with that fall under the special education umbrella generally are able to stay, well, they are able to stay in school till the age of 21. And it's not, time flies very quickly. It's not, I know it seems like a lot of time. That's, I'm not sure, 5-6 years, but time really flies. So really think about what, if you had to transition today, like let's suppose you're a freshman in high school and you had to transition into adulthood today, what are your current what is your current skill repertoire? And when I say that, I mean, what kinds of things do you already know how to do independently without anyone helping you accomplish those tasks and without anybody telling you that you have to accomplish those tasks? Really look at what your I look at what my clients are currently able to do, and that will kind of help me plan ahead. And it kind of helps you prioritize kind of the objectives when you're doing transition planning. One thing that I feel like a lot of people lose their way, I've seen a lot of IEP goals or just different programs that focus on the same kinds of skills that children are learning. There's some academic skills that we've got a limited amount of time to really master them. So if you've been working on something for many, many years, now is the perfect time to just start thinking, okay, we might have to skip ahead. We might need to work on something that is a little bit more relevant to wherever my person is going to transition into when they become an adult. Perfect example, if you're teaching somebody, I don't know, let's just say addition and subtraction, and they're really struggling with various concepts within that, like carrying digits over, or the one-to-one correspondence. I mean, there's just a variety of different skills, prerequisite skills involved in that kind of a problem, but then you start thinking about adulthood. Well, what does this person need to know when they become adults? They're going to need to know how to pay. Maybe they're going to go to a restaurant and they don't know how to pay their bill, or maybe they're going to go to the store to buy groceries and they don't know how to complete a transaction. They might need help budgeting. There's all these things that involve math. You might want to start considering a calculator, because it might open up a world of opportunities. Like, you're basically trying to streamline procedures, make them a little bit easier, because now everything's kind of coming to a point, I don't want to say to a close, because we don't ever stop learning, but now preparing for adulthood means you're going to have less and less support. As people age out of services, as things aren't as readily available. And so you're really looking at, okay, let's close out certain programs. Let's start really thinking of maintenance and generalization, like what do we currently have and how can we build on that? So that's something that I really encourage a lot of people to do, is to really prioritize what are the priorities currently and into adulthood. Now, I tend to focus a lot on caregiver training and on advocacy. I'm working with for that. Like I said before, unfortunately, and adults don't have access to as many services as children do. There might be many reasons for that. You know, a lot of people focus on pediatrics, so finding therapists, doctors, I mean, a whole range of services sometimes gets a little complicated. The public education system is no longer available after the age of 21. So now you're looking at, does my will my client go to college? Like, will they go to community college? Will they go to a regular university? Will they go to a day habilitation program? Will they become employed somewhere? I know that there's a few organizations in town like HEB that work very closely with schools, and so some of our clients are able to gain employment after high school, but really resources start becoming more and more limited for adults with disabilities, and that's where caregivers become almost the primary members of a client support system. Society's evolving. It's becoming more and more supportive of people with intellectual disabilities, but we're not where we need to be. And that's where caregivers really need to know a lot. As a behavior analyst, I do train caregivers on behavior modification. I train them on how to do my job, basically, how to do what's called a functional behavior assessment, because they might not find behavior support services for autism or various other intellectual disabilities. And so they really need to be the ones that, it's almost like they become experts on all subject matters. And that's where advocacy really becomes important. A lot of caregivers, of adults with disabilities are responsible for behavior modification, for daily care, and that can be very difficult, especially if you're juggling your own job and then your own responsibilities, your own family, your own chores. I mean, there's just a wide variety of things that caregivers are tasked with doing, and advocacy becomes really important. A lot of the adults that I work with receive services through Medicaid waiver programs, and it's a process, and so being able to know how that process works and who does what and how people move through different systems is going to be really important for caregivers. And that's where caregivers in general need to be really good at asking questions. You've got to be able to understand the information that's presented to you, and don't feel bad. A lot of people may maybe feel one thing that I've noticed a lot working with kids with disabilities or kids with autism is that a lot of times the family kind of rearranges their schedule or their lifestyle around the needs of their children. And oftentimes it becomes unsustainable when they exit school. So right now, for example, if you have a child with autism that's going to school every day and you take advantage of that opportunity to go to the grocery store, to go to the gym, to do all these things that you wouldn't normally do around your child, you're not going to have school as a support anymore. In fact, it's sometimes it's hard to know what really is in place after high school. It's hard to make those kinds of projections, and so you really need to prepare your child to be able to go to the store with you successfully, to be able to go to the gym, to be able to do what you do, to go to church, to go to all kinds of environments. And I also mentioned active participation in all environments. So that includes school, community, and in their social network. And it kind of goes hand in hand with advocacy. What I've noticed with a lot of my clients is they've received so much support throughout the lifespan. And sometimes it becomes kind of second nature for the rest of us, the caregivers, whether you're a parent or a therapist or a teacher or anyone else really that supports a person with an intellectual disability. It becomes second nature for us to advocate on behalf of our clients, and that it's kind of a double-edged sword, because it's great because you're helping that person get their needs met, but also you're not setting up a situation where that person learns how to get their needs met. And so when you're having ARD meetings or any sort of meetings, PDP meetings, any kinds of meetings where your client is receiving support, you really want your client to actually be answering questions, asking questions, really actively participating in the dialogue. So you start small and you build up. If you're going to make dinner, you ask your child what is it that you want for dinner, or you have them go to the grocery store to buy the ingredients that they're going to use for dinner, or you don't make dinner at all and wait for the individual to be hungry and say, hey, what are we having for dinner? Okay, well, that's on you. Let's do this together. I've seen one thing I run into a lot is I'll ask somebody a question, and a lot of my clients, they do need some extra processing time. I attribute this to sometimes there's a cognitive reason for it. Sometimes it's really they'll answer the question, or they'll rephrase the question, or they'll help the individual with context clues, and they'll start, prompting and jumping in to help. And what I always encourage people to do is just wait. Sometimes that can be very awkward. I've talked to clients where it's so awkward because I ask a question and we wait and wait and wait for up to a minute, and I might reword the question. And then wait and wait and wait. But you really need to we really need to push our children with autism and with disabilities in general to answer questions about themselves and wait for them. When we were talking about manned training, one of the things we were talking about was waiting for motivation before jumping into prompt, before saying, what do you want? Or do you want this? Or say apple, or say whatever. That is such a basic form of advocacy, but you can build up from there. And so get really used to waiting for people. And I've even had conversations with my clients where I say, I want to hear from you. So I'm going to wait. And you can raise your hand and say, I don't understand. Or you can answer the question as best as you possibly can. The answers don't have to be right. And really validating my clients. If I ask, what are your goals for adulthood? For example, for an ARD meeting, or what are your, what are your learning objectives? Wording them in a way also, using more inclusive language, wording them in a way that our clients really understand what it is we're asking them is really important, so that you don't have to interpret. Like, really think long and hard before you ask a question, because a lot of times people will ask a question and then just keep changing it. Like, what are your learning objectives? Okay, what do you want to learn? Okay, so like in math, you learn addition, subtraction, and we start prompting and prompting. So we need to be very careful and kind of know our clients and how to speak to them before we ask them questions, so that we don't run into that, because it's very hard to be independent when the questions asked of you or the expectations are so confusing. And use lots of delays, and encourage your clients to really to jump in and speak up and give them time. Another thing that I've noticed, other than not giving people enough time to really process, is there's not a real big social support system in place for people when they graduate from high school. And that can be very lonely and very isolating. And you sometimes see adults with IDD and start having some behavioral issues. I often get referrals for people that they want to date, or they want to have intimacy, or they want to have friends, and they don't quite know how to navigate these complex social situations. So it comes out inappropriately, but also they don't have much of a platform. And so I think the best thing you can do is start trying to find organizations where people with disabilities go to have fun. That's really crucial. Where can I make friends? One thing I teach a lot of people how to do during transition planning is learn how to Google stuff. If I were an adult and I wanted to make friends and I wasn't in school anymore and I didn't work, or even if I did work, where would I go to make friends? And sometimes you can Google Special Olympics, or social skills groups for people with IDD, groups for people with autism, autism support groups, autism events. I mean, there's just so many different things you can Google. And a lot of our clients, and I think that goes hand in hand with self-advocacy, a lot of our clients, if you were to hand them a phone and say, look for a Special Olympics event, they wouldn't know how to do that without you prompting them throughout. Okay, well, click on Safari. Okay, now type this or that. Or how do you do talk to text? Because a lot of times you can say, hey, Siri, and look something up. Or you can, for people that don't know how to read and write, technology is so advanced now that you can still Google things, and you can still text people without really knowing how to spell things out. So those are things like we really, instead of going out and finding a resource for our students or teenagers, we need to really tell them, like, hey, I think you should find this resource. One thing that becomes really important is functional behavior assessments. So the premise behind a functional behavior assessment is every behavior communicates something. It communicates a want and a need. And sometimes, you might have a behavioral issue because you want to get attention. In other words, you want to have some sort of an interaction with other people. Or you might want to have something that you like, but you don't quite know how to ask for it, or you have a hard time waiting, or you don't like it when people tell you can't have something, or you might not want to do something. You might be in a bad mood and you don't want to do your homework, or you don't want to, go to the store. There's or you might have pain and you don't know how to really alleviate the pain. There's so many reasons why a person would have a behavioral issue. And it's really important, I think, for caregivers to know how to do a functional behavior assessment, because that's the assessment that you would use to find out the why. Like, why did this behavior occur? Like, what was the purpose of it? What was the function? And then to know what the behavior intervention plan then would include is, okay, how do I replace it? How can I teach a skill that's more appropriate and more effective in giving the person exactly what the problem behavior gave them in the first place? So for example, one thing I have noticed with a lot of adults is that their social network kind of decreases pretty substantially when they grow up. They don't have access to as many peers and other people that they can interact with. And so, and the people around them are busy. And so a lot of times you'll notice people start having attention-seeking behaviors. And it's because in the past, they were receiving attention just inadvertently, like they were transitioning from class to class, they were learning, they were in the classroom, they would go to PE, and now all of a sudden those supports aren't in place, and it's almost like they were passive recipients of services. And so now they're expected to initiate social interactions. So what happens if you put somebody with autism in a room full of people with no supports in place, no real expectations, no schedule, no prompts? How do they make friends? How do they interact with the people around them? And that's when you start seeing behavioral issues, because they just haven't been taught these skills. And so, and that's just something, with transition planning, you don't want to learn these things through hindsight. Like, really imagine when you're thinking about adulthood, what if I leave my child with autism home alone or in a social environment? What are they going to do? And that's what you really need to be teaching, among many other skills. But I'm talking about social skills right now, because that's a really big one. And so teaching caregivers how to do an FBA is really crucial, and teaching them how to find the reason for problem behavior and then replace it with something better, and then how to teach our clients those new behaviors. That becomes crucial. Sometimes for some of my clients that are able to have a little more introspection and cognitively can kind of go through this process, I sometimes will have my own clients do their own FBA. So I might ask them, what do you get out of this behavior? Or why do you think you do it? Or what happens, when do you usually have this behavior? Is it when you're alone? Is it whenever someone asks you to do something? And then what happens afterward? And so just kind of having these discussions with them. So doing their own FBA, and then and then you can sell them the intervention if they kind of participated in the process, going back to self-advocacy. So sometimes I'll tell my clients, it seems to me like you really like to socialize, like you might do this for attention. What can we do differently to get attention? Or it seems to me like sometimes you don't want to do things that people ask you to do, and that's why you have this behavior. What's a better way to get out of things? And so we start brainstorming. Sometimes my clients come up with good ideas, and sometimes I might have to help them. I might say, what if you take a break? What if you say, I don't want to do this right now. I want to take a break, and then just start practicing and practicing. Again, practice makes perfect. So what an FBA is that you look at the behavior and you come up with, you define the behavior. And it's basically, behavior is anything that you can see and you can measure. For example, acting out, those are not behaviors because they don't look the same to everybody. You have to further define them. Like, how would I know if someone had anxiety? How would I know if somebody was acting out? Well, then that's when you really start defining the behavior. Behaviors can be kicking, spitting, yelling, you know, going, leaving an area. Those are things that you can actually see and measure, and if you explain them to someone else, they will be able to see the exact same thing without needing a whole discussion about it. So you define the behaviors and you come up with antecedents. And what we mean by that is, what are all the things that happened right before the behavior took place? And consequences, a lot of people think of consequences as discipline. In the world of ABA, we think of consequences as literally what happened right after the behavior. What was the outcome of the behavior? So, for example, if you have someone that every time math class starts, they leave the classroom, and as a consequence, they're able to enter a different classroom where they get lectured. So you look at the antecedent was math. You look at the behavior, in this case, let's just say elopement, running away. And the consequence is that they did essentially get rid of the math expectation. Like, they were no longer in math class. They did get a lecture, and they also got to avoid math. So consequences are usually the things that happen that make the behavior stronger. So we can assume that lecturing the client or allowing them to get away from math are what we would call reinforcers, like they make the behavior stronger. So, teaching people, well, okay, so what should we do when math class starts? Ask to go to the restroom, come back when you're ready, or try to do a little bit of math and then ask to leave. Like, the thing about behavioral programming for adults is that, one, they are larger, and two, they should have a sense of autonomy. And so forcing an adult to do something they don't want to do is unrealistic in a lot of cases. And so the more you can get buy-in from your clients, and the more you can have a collaborative process, and the more you can look at antecedents, like what had happened right before the behavior, and really prepare your clients by teaching them something better, or changing the antecedent. Like, instead of having math class, maybe the teacher comes in and immediately starts lecturing. Maybe the teacher can come in and say, hey, we're going to do math. If you want to take a break, just raise your hand. Those are things that you kind of do in preparation for the behavior. So one thing I encourage a lot of people to do is, a lot of caregivers, is to see if you can find some sort of a tracking device for elopement. Elopement, I've noticed, can become really detrimental to a lot of people. I've seen a lot of people run away from their programs, run away from home, and it just causes a world of problems. I've had clients that nobody can find them, and it's really, it happens far too often. And so there's devices out there like watches and wristbands, different things that you can buy just to kind of know where they go missing. That's always a good idea. Someone is, if they go, that's yes, so you don't have to worry as much. And like I said previously, focus on prevention strategies and on teaching replacement behaviors. If you have a client, for example, that's engaging in problem behaviors in order to gain attention, if you're waiting to react, you've waited too long. Because what you'll run into is, if you ignore the individual, their behavior is going to get worse because they don't want to be ignored. And so whatever they were doing before is going to get worse. For an adult, that can be impactful. Adults are larger. Adults are capable of a lot more than children. And so, if you were to ignore somebody that was engaging in attention-seeking behaviors, realistically, you might not be able to, because things really could get out of control very quickly. The other problem with being reactive as opposed to focusing on prevention and focus on teaching is that it's really hard to learn that way. A lot of times I've seen caregivers and staff reinforce problem behaviors, obviously not on purpose, because we all just kind of react to situations the best that we can. But when you're doing de-escalation techniques or reprimanding someone or giving explanations, a lot of times you're reinforcing the behavior. And I've seen that a lot of adults that they might be in an environment where they don't really get any attention. Everybody's busy. And so what are they doing? They're, and if they don't have any way to really entertain themselves, they don't have any hobbies that they do independently, then they might start, hitting other people or yelling or cussing or, just to give a few examples. And by the time that's happened, there's not much you can do. The behavior has occurred. But if you can say, you know what, this individual, it seems like right around lunchtime, or it seems like every hour, or it seems like twice a day that they're having these behaviors, and they're getting lots of reprimands and lectures and lots of attention, then what you would want to do is give attention more frequently. You know what, I'm going to check in on this person once an hour, and just you give them praise. And so we use praise a lot. Wow, you're really doing a great job. I noticed that you're watching TV and you're sitting there quietly. That's really good. Thank you so much for that. Or, hey, I'm about to start washing dishes. You want to come join me? Those kinds of things. So if you see a behavior that's happening every hour, you want to provide attention, I don't know, every 45 minutes. You want to give the client exactly what they're gonna get, whether it's attention or some other form of consequence, before they even have a chance to engage in the behavior. So by doing that, you kind of set your clients up for success. And then you can get to the next level of teaching, like, hey, you know what? I want to teach you how to get attention from others. How about every time somebody walks in the room, tell them, how's it going? And so your client, now that you've kind of set them up for success where they're not having to have behavioral issues in order to get what they wanted, now you can really focus on teaching. But behavior intervention plans, they are long-term, they take careful planning, and they are time-consuming up front. But through time, you can kind of fade them out. And I know I've been talking a lot about attention-seeking behaviors, but I do tend to see those a lot because in adulthood, the demands are lower. You're not in school anymore, so people aren't expecting you to do all these things. But also, you don't have as much access to socialization opportunities, and so you do tend to see a lot of attention maintained behaviors when you're working with adults. That's been my personal experience. I don't know statistically what it's like for most people out there, but my personal experience has been that a lot of my clients do engage in attention seeking behaviors because they don't have as much access and they don't know how to initiate social interactions. Another thing to consider with transition planning is independent recreation and leisure. So if you had a room full of toys, for example, for an elementary student, or a room full of just preferred age-appropriate activities, and you left, what would the client do? Would they initiate doing any of those activities? I think that that's an interesting thing. Like, what do people do when they're home alone, or what do people do when nobody's asking them to do anything? And a lot of times what I've done for a lot of my clients is set up a visual schedule. So sometimes a visual schedule for people that can read and write looks like a checklist. You just write out the first thing we're going to do today, the second thing, kind of like lists. Or for people that can't read and write, pictures. So we're going to do laundry, then we're going to play basketball. Visual schedules really help because as we learned previously when we were talking about prompting and prompt fading, visual prompts are a lot easier to fade out compared to verbal prompts and any other kind of prompt. And so if you can set up a visual schedule, a lot of times your clients can kind of learn their routines. And so that kind of opens up a lot more, opens up the door for a lot more independence. You know, a lot of our clients, they do have a hard time kind of structuring what their day is going to look like. And so sometimes they do need help doing that. Like really try to see your client as someone that isn't going to have you around and isn't going to have all these supports around forever. What does that look like? And put the responsibility on them. So I do work on a lot on independent leisure. Like if someone had a basketball around them, would they know how to play basketball? If they had a foosball table, would they know how to use it? Would they know to use it? Would they know how long they have or what time they can do this? Or would they just sit around waiting for someone to say, hey, it's time to go play foosball? You know, and really trying to find out age appropriate preferences, like can this person ride a bike? Can they walk on a treadmill? Can they take a walk to the park? Can they you know, swing on swings? Like what can they do? What do they enjoy doing? And do they know when they can do these things and for how long? So that's what transition planning is all about, is really looking at the environment. Like, what is this person going to be living like? Who are they going to be around? And that's really at every level. I think transition planning, although we focus on it a lot for adulthood, it really needs to be a focus of every transition in a person's life, because environments change. And we've been talking a lot about generalization issues. A lot of people with autism, they really struggle with generalization. So how do they know to go from one stage of life into the next, one environment into the next? So we're going to start with elementary transition planning. So when you're going from home into elementary school, or you're going from daycare into elementary school, you want to look at what does the classroom and the routine look like. And you want to create something very similar. You want your child to know whenever it's circle time, what does that expectation look like? And how do you fulfill that expectation? When it's time to go to PE, what does that look like exactly? And how do they know what to do? You know, really start exposing people to some of these things that they're going to encounter when they transition. And that's why I think a lot of times having a behavioral therapy program that kind of goes out into the community is really helpful, because they can kind of I guess there's more flexibility to go from one environment to another. But you know, I've seen a lot of situations where a client might be at a desk all day, you know, receiving ABA therapy services, but then a regular classroom, the kids might not sit at desks that often. They might actually spend more time moving from center to center, or they might spend more time in more experiential type of learning activities, like playing with Play-Doh, or you know, going to centers, or doing circle time, or singing and dancing. And so we really want to see what does that look like? What does the teacher say to the kids? Like, what is their cue to transition? Some teachers sing a song, or you know, they sing songs for different transitions, like the cleanup song. So it's really trying to look at, what does this environment look like that I'm about to transition into? The other thing is, how do children interact with each other? Like really paying attention to other children's interactions, because sometimes when we're teaching our kids with autism social skills, we're really just preparing them to socialize with adults, because when we put them with kids, kids don't do the same things that adults do. And so really paying attention to kids, how they talk to each other. You know, if you join a group of kids, typically you wouldn't go in and say, hello, my name is so-and-so. What's your name? How old are you? Where do you go to school? Kids don't tend to have these elaborate kind of chit chat, small talk kind of conversations. So how do you then initiate an interaction or join a group of other kids. If all you've ever taught is that kind of stuff, the chit chat, conversation starters, or answering questions. Some kids might, I've seen kids on the playground, like a newcomer kind of going into a group, they'll observe the other kids and they'll find an opportunity to be of assistance. So like if the kids are, I don't know, let's just say as an example, they've decided they're gonna put rocks, transfer them from one place to another, or they're gonna play tag. I mean, kids are very creative. There's no telling what they're gonna do. Sometimes you can, the newcomer will typically watch and they might say, "Oh, can I help?" Or here's a rock for you. That's usually how kids kind of engage other kids. That's kind of how they join a group. All of that stuff that's second nature to a lot of kids, to our kids with autism, it has to be taught. It's not second nature. And that's where it's on us as caregivers and as therapists and any kind of service provider to really pay attention to our surroundings and the people in our surroundings, and what do those behaviors really look like, and directly teach that to our kids. We don't want to teach something foreign. We want to teach them exactly what they need to know to survive in that environment. Also, what do other children like? So we do a lot of preference assessments. And basically what that is just trying to find things that appeal to our clients. We use those a lot of times as reinforcers, but I think it is really important to see what other kids are into, because it's going to be very hard to relate to other kids, to find common things that you have in common if you're not exposed to the same things that they're exposed to. I think it's easiest for elementary kids. You've got blocks and Play-Doh and tools and different pretend play scenario setups that most children are pretty familiar with. And so you want to find out, what does your child really like? And you want them to like more than just one thing. I know a lot of kids with autism, they tend to really focus on one thing. So being able to expose them to other things that they might like as well, and really exposing them. A lot of kids with autism, they might not know how to play with a certain toy or certain activities, and you might actually have to model it for them and give them incentives. So for example, let's work on making a sand castle together, and when you're done, we can then play with Lego. Sometimes I use the activities my clients like as a reinforcer. So if I have a client that really loves Legos, I might say, you know what, let's go play with like let's pretend we're cleaning up in the kitchen. Let's do pretend play, and then we'll play with Legos together. So they kind of, it's time limited. They don't have to play in the kitchen forever. So that's reassuring. And they know that afterward, they're going to get to play with Legos. But it is really important to start exposing them to more and more things, and really listen to what kids are talking about. What kinds of video games are they playing? What kinds of games do they play at recess? What do they talk about? And really start what kind of movies, shows, cartoons, and really start showing those things to your child and see what they like, because they're bound to like something. You just have to keep trying and trying and trying. Their interests might not be as varied, but there's bound to be something that they like. And it's the same thing going into middle school, same concept, classroom and routine. Middle school is when kids typically start going from classroom to classroom and they get a locker. So that's one thing that you would want to practice is, what happens when the bell rings, and how do you, how do you find your way, and how quickly do you need to walk without bumping into people, or without, doing it the way the other children do it, to the extent possible. Social skills are really, really hard to navigate, and they get harder and harder as you get older and older. And so the more you can prepare in advance, the better. I've had a lot of kids with autism. They get a lot of anxiety just because all these situations are so uncertain. So if you can show them in advance what it looks like and what's expected of them and get to practice, that's very, very helpful. You know, again, we're talking about peer preferences and interactions. What are middle schoolers into? And that's where I think parents in general or service providers, we need to be very flexible. Some of the things that middle schoolers talk about or some of the things they might like to do aren't as appropriate as we would like them to be, you know? So you really kind of have to think, what am I going to allow and what am I not going to allow, and what am I going to encourage? And so really trying to find preferences that are, you know, appropriate and that they're age appropriate. So like video games, again, you know, watching movies, playing video games, you know, there's just so many different things. Legos, I think in middle school are still, you know, still appropriate. But really just paying attention to other kids and paying attention to your surroundings and really exposing your child to those new things that they're going to encounter in middle school. Middle school is also, what I've noticed is academics. Well, everything in general starts getting more and more complicated, but you definitely see it in academics. I think there's a big emphasis in just in school in general. I used to be a teacher when No Child Left Behind, you know, came out, and there was a big push towards, you know, age-appropriate academics or grade level academics. And what I've noticed happens is that the gap between our clients and their peers, it just grows. It gets larger and larger and larger. And so they're moving through their academics so quickly, but they're not really mastering the prerequisite skills for those academics. And so what you end up with is students that are what I would call prompt dependent, relying very, very heavily on prompts. You know, I've done worksheets with clients in middle school where, I mean, I had to teach them every concept from beginning to end because they really didn't have the prerequisite skills. And then the class would move on to the next concept, and so we had to start this all over, and there was never really, it was really hard to find opportunities for that person to do these things independently. You know, like math, one concept builds onto another and so on and so forth. And it's like that with all the other content areas. And so one thing that I often do is when I'm teaching, helping someone with academics, is really try to break it down into all these components. That's called task analysis. So in order to you know, read a chapter book and comprehend, well, what do you need to know? Well, you need to first know how to read phonetically. So general, and these are things that you can talk about with teachers, but general guidelines, if there's 2 lines of text and you are having trouble reading, making out certain words, then that level might be too hard. You might have to go back. So that's one thing, reading phonetically. Another thing, you know, comprehension. Like if I read one sentence in a book, can I then, you know, paraphrase? Can I tell you what that sentence was about? And I do think verbal ability and reading, they kind of go hand in hand. If you're in a conversation and you're listening to other people speak, can you then summarize the conversation? Can you talk about, you know, what the topic was? And so we might have to, you know, focus on reading shorter passages and coming up with what the topic is, and then building those into longer and longer passages, paragraphs into pages, into entire chapters, and so on and so forth. But I think it is really important to pay attention to prerequisite skills, because our kids do fall behind. And when you start depending so heavily on prompts, it's like you're going through life with a GPS. And that's really detrimental to transition planning, because I think that really is the most important thing about transition planning is, can you do the things you're supposed to do without anybody telling you you have to do it and without anybody walking you through the whole process. And so sometimes you have to break skills down and make them easier, go backwards in order to ensure greater independence. And I think that that's okay. But I think it's worse to try to keep up with your peers at the expense of your independence. So it's kind of, there's a lot of judgment calls that you start making in the middle school transition. Task analyses, so that's, checklist, step-by-step instructions, kind of like, I think of task analyses like if anyone's ever bought IKEA furniture, it's similar to how IKEA, their little manuals, how they explain the assembly instructions. That's what I think of with a task analysis and a visual schedule and all these other visual prompts. It's like very easy how-to manuals. And sometimes you have to make those for social skills, for new routines, and for academics. Like, get used to making task analyses, little easy how-to manuals, because a lot of the things that for the rest of us are second nature, and we just kind of observe other people and we kind of follow along and repeat them. For a lot of kids with autism, that's a little counterintuitive. It's not that easy. They really do require us to teach them those things that the rest of us just kind of know. In middle school, I think it's very, very important to really start thinking about extracurricular activities, because middle school is tough socially just in general for any kid. A lot of kids are having a hard time fitting in middle school and really finding out who they are and who their friends are. But with our kids with autism, it's especially challenging. And so if you can put your kids in extracurricular activities, you're kind of giving them like a support system at school. Like, they're able to have peers that they have something in common with. They're able to master something outside of school, whether it's sports or, or other activities like a coding class. A lot of kids with autism, they're really into programming and coding and real intricate things. If you put them in something that they're good at or something that they can become good at, then that's something that they can get a lot of attention for, a lot of validation, be proud of, and they'll be able to meet other kids that are just like them, that have the same interests, that have something similar to talk about. And going back to age-appropriate preferences, when we were in elementary school, we were playing with blocks and Play-Doh and bubbles and all these other activities. In middle school, it gets a little more complicated, and I think that's where exposing kids to sports is a good idea. They might not have the motor skills. Some of our kids might not have the motor skills to really perform certain tasks, but just knowing what to do on the soccer field, knowing what to do on the football field, like being able to play with your peers independently without adults around is really important. So if you're around a bunch of peers and they say, oh, let's go shoot hoops, are you going to be totally clueless, or do you at least know, oh, I know what that's like, I can go too? Do you know how to ride a bike? Do you know, just running. I had a student that we worked on teaching him going up and down the stairs quickly, because it was a problem for him in middle school. One, because one of his classes was upstairs and he was always late to class, and he was so scared, like he wouldn't alternate feet from step to step. He would just step on one with both feet, step on the next, and he was getting bullied because he wasn't able to, people would notice and they would make comments about it, and he was always late, and it was causing him a great deal of anxiety. And so one of the things he asked us to was to help him with this, and we were walking up and down steps all the time, practicing, because it was really important for him. He didn't want to be called out all the time for being late to class. He didn't want to be noticed in that manner, and he certainly didn't want to be made fun of. And so he eventually figured it out, and then he was able, in the beginning, they were letting him leave class early to go to the next class, But he didn't like that either because that was stigmatizing. None of his friends were leaving early. He was the only one, and it's because it took him a long time to go up the steps. So being able to leave class with the rest of the students and being able to go up the stairs with the rest of the students was really important to him. So, I mean, there's just so many things to consider, and it really boils down to the environment. And of course, prompt fading, it's so important. You want your child to do the things they're supposed to do independently. You're better off making things easier and ensuring greater independence versus making things so hard that you have to prompt someone through life. You really don't want, like, I don't want my clients to be passive. I don't want them to just have that routine of I sit at my desk and I wait for the teacher because I don't generally know what to do, because that carries over into adulthood, and so we really just need to take it easy with our kids and teach them at their level, and make sure that whatever step in the process that they're at is to focus on them doing that independently. And again, like asking questions, always give people time to process, giving expectations, write things down and say them, give people lists, use as many visual prompts as possible, and really give people a chance to process, so that you're not constantly repeating instructions and rephrasing them and prompting and providing all this assistance. So we can move on to the next slide. Okay, so high school and adulthood, we start focusing a lot on independence. I mean, this is, in terms of transition planning, adulthood is the big end goal. Social media becomes a really important topic in high school and adulthood. I have a lot of clients that they're wanting to get on social media just like everybody else, and they oftentimes don't really do it safely. I've got a lot of clients that are making friends with complete strangers that may or may not have the best of intentions, and that may or may not influence them, the right way. And so really teaching, a lot of people have a problem with exposing adults to social media because it's out there, it's on the internet, it's not safe. But I mean, they're going to run into social media regardless. And so we have to teach them, like, all the social skills involved, like who can you follow, who can follow you, how can you meet people. And what you start noticing when people start using social media as a way to socialize, you start realizing that they don't have access to peers. They don't have access to social outlets, and they're using social media exclusively. And you really want a combination of the two. So you can actually use social media as a resource. What's going on in the community, in the world of IDD? Are there any support groups out there? Are there any, Special Olympics or different recreation activities for people with autism? Like, what's out there? You can use Google, you can use social media, but all these things that we kind of know to do, we really need to teach our clients how to navigate social media and how to navigate the internet the way that we would. I wouldn't friend just anybody. I'm very private when it comes to who I'm friends with on Facebook, because I don't want people to know what I'm doing. I'm also very private with what I post. There's Snapchat, Instagram, Facebook. On Snapchat, you can have private groups. So if you post something that might be appropriate for that group, it might not be appropriate for everyone on Facebook. So these are things that you really should consider teaching, so that the person that you're working with isn't getting into trouble. I've had plenty of clients, they're interested in dating, and they go on Instagram and people ask them for nudes, or they start requesting nudes, or they start inviting people on dates. And I've had clients that have invited minors to go on outings with them, or they've posted things that were unsolicited, and it's really because they didn't really know a better way. And so again, it's the same thing. Look at who are the people in the environment and what are their behaviors. You know, in elementary school, we were teaching elementary school social skills. In middle school, we were teaching middle school social skills. In adulthood, there are social skills that young adults engage in, and how exactly do they do that? You have to direct teach these things so that our clients can do it successfully without getting into trouble. You know, independent recreation and leisure, we've talked about it so much, but really it's so important. It's so important knowing, you know, giving people access to recreation activities, such as, you know, having a basketball hoop or having a soccer ball or having a foosball or video games or whatever, because if you were left home alone, what would you do with your time? The next area that you would focus on, vocational skills and preferences. What does your client like to do? What are they good at? And really start honing in on that. It's not one size fits all. In general, just like the rest of us, we don't all work at the same place. We have jobs that fit our personality types. It's the same with people with autism. They want to have jobs that are fulfilling to them. I think there's more awareness now, and there are actually organizations out there that are willing to work with job coaches, and they're able to hire people with autism or people with disabilities in general. You know, so really try to find out what is the person good at and what do they really like to do, and really start honing in on that. I think it's almost time to go, right, Emily? We've got like 10 more minutes.
A few more minutes, yes, ma'am. I'm sorry about that.
No worries. We just have so much to cover. Should we continue on for the next 10 minutes, or should we do a part 3? I think I'm pretty much, I mean, we're almost done.
Up to you.
Okay, well, I'll continue on and see how much of this we can cover for the next 10 minutes. Social support network, again, very important. Use social media to find events in town. Use the internet. Teach people to do this. Socialization is important to everyone. I don't care who you are. We all want to have a friend. We all want to have a group of people that we belong to, and really trying to find these opportunities is very, very important. Without it, you end up living a very restrictive life, and then you start seeing you start seeing a lot more behavioral issues when you have people that are really don't have much of an outlet. They're just kind of stuck at home all day. Skills of daily living. When you're in high school or you're an adult, can you wash your own clothes? Can you wash your dishes? I mean, what are the things that the average adult does every day? And sometimes people with autism, they just need help structuring their day and knowing what's expected of them. And that's where I'm a big fan of visual schedules, because it kind of helps you. I mean, we have agendas, we make checklists. That's essentially what a visual schedule is. It kind of helps you, okay, so I'm going to have, you know, work from this time to this time. When I come home, I can relax for 10 minutes. Then I can kind of make dinner, eat dinner, wash dishes, and then I've got some free time, and then I have to start my nighttime routine. I mean, we all do it, but some of us do it in our heads, and some of us might need a visual schedule, and some of us might not have the skills we need to have. Like, I might not know how to cook myself a meal, you know, and so we might need to teach our clients how to use the microwave and then eventually the stove. And when we're talking, person-centered planning becomes really, really important. And again, really try to use inclusive language. When you go into a meeting that's about an adult client, ask that person questions in a language that they would understand, and really see them as the primary person kind of making the decisions, really, really, I think it's a matter of respect. You know, put yourself in that person's shoes. They're planning their future. They're planning their short-term and long-term goals. Really, really try to get on your client's level and really try to make sure that they understand what's expected of them. You know, one thing that's really big for me is when I'm doing informed consent for my services as a behavior analyst, I always ask my clients, even because a lot of times my clients are their own legal guardian, but they need help. You know, they might, you know, some of these forms, like our informed consent form, might be too hard to really comprehend, or they might have questions, or they might not know what to ask. And so I always ask my clients, who helps you make decisions? And a lot of times they might say, well, my mom or my dad. And so I'll tell them, here's this form, and I explain it to them in a language that I think that they will understand. I check for understanding. Like, do you know what I mean by, you know, dual relationships? Or do you know what I mean by confidentiality? You know, see if they explain it to you after you've explained it to them. And then I always say, please don't sign this right now. Take it home and ask your mom to help you understand this, whoever they said was their person. I think it's in terms of advocacy, I think it's really important for clients to know that they don't have to sign something just because you present it to them. You know, I think a lot of times we get into the habit of like, here, sign this, or here, come here, or here, do this. But we don't always get consent from our adult clients, and that can really make them vulnerable. I have good intentions. A lot of us out there have good intentions, but there's a lot of people out there that don't have good intentions, and we need to be very mindful of that, is that you know, we live in an environment where not everyone's the same and not everyone's benevolent, and that's the environment that our adults with disabilities live in. So you know, so that's really big for me. It's like, yes, I'm going to explain things to you in a way you'll understand, but I don't expect you to sign in front of me. I expect you to ask questions and take this home and read it over with your family, and then come back and sign it, so that I know that you are advocating for yourself.
Okay, I think we're gonna go ahead and do a part 3 on this last part, because I don't want to not give it the attention it deserves, because I know on the TST we run, and these are some major things that we run into. So I definitely want to give this the attention it deserves, if that's okay. And then we'll just
absolutely go. I agree, and it probably won't be as long of a video, but it is a really important component to transitioning into adulthood.
Yeah. Yes, so we'll go ahead and make a part 3 for everyone. Again, if you need any further information, feel free to contact me. The main way to contact us is through tst@acog.com. I hope you enjoyed this video. Anna is very brilliant when it comes to working with people with IDD, and she's got some great insight. So Anna, I appreciate your time once again.
You're welcome. Thank you for having me.
Sure. All right, we're going to go ahead and conclude, and you guys take care and keep up the good work.